Oculofacial plastic surgery is becoming more and more super specialized and is constantly expanding its frontiers. This video demonstrates the surgical technique in a patient who underwent a Plasty and a cheek rotation flap for a huge malar scar. The scar was subsequently treated with carbon dioxide fractional laser resurfacing, and the patient was left with an extremely acceptable cosmetic result. The story starts about 2 years ago when this 17-year-old girl was involved in a ghastly road traffic accident. The accident left her with a huge malar scar and upper eyelid shortening which would not allow the upper eyelid to close. The psychological impact of such a huge scar on a young girl can only be imagined by us. The impact is potentially so huge that we turn around and say that we are operating on the face, but we are actually treating the brain. From a surgical standpoint, the surgeon needs to be extremely careful in treating such a huge malar scar. Any error could potentially result in a lower eyelid ectropion, and that would be disastrous both from the points of view of vision as well as cosmesis for the patient. Keeping this in mind, we decided to go for a Plasty which would be performed to revise the scar. Our group has one of the most experience with fractional carbon dioxide laser resurfacing for facial scars as well as for facial rejuvenation in pigmented skin in the world. Given our experience, we felt that the patient would benefit from fractional CO2 laser resurfacing of the residual scar post-scar excision. A full thickness skin graft was planned for the upper eyelid shortening. The surgery was performed under general anesthesia and the scars were initially marked for the Plasty. Skin incisions are made precisely on the markings with the help of the Colorado tip fixed on the radio frequency. The scar tissue in the central malar area is excised. The edges of the cheek are undermined in the SMAS region in order to create the cheek rotation flap. Adequate release must be done for a tension-free scar closure. The cheek rotation flap is rotated into place to check the same. Closure in a Plasty is extremely important and has to be meticulously done and planned in order to avoid an offset of the lower eyelid against the globe. Hence, closure proceeds from near the lower eyelid downwards towards the mouth. The closure must be from the upper elevations of the nasolabial flap to the lower depressions of the cheek flap. The same procedure as the cheek is repeated for the chin. A lid crease incision is made for the left upper eyelid. The underlying scar tissue is excised. A full thickness skin graft is taken from the left retroauricular area. The donor area is sutured with 4-0 silk. The skin graft is thinned carefully with fine scissors. The skin graft is fixed firmly in position with 6-0 proline interrupted sutures at the periphery and tissile glue at the center. Adequate wound compression is provided with steri strips and with Dynaplast. This is how the patient looked in the immediate post-operative period. The first sitting of carbon dioxide laser resurfacing was done within a fortnight post-surgery, and the second sitting was repeated a month and a half post the first sitting. Copious topical applications were used in the immediate post-operative period. The patient has now completed a 2-month follow-up and is very happy with how the scar is shaping up. The scar will of course keep remodeling and getting better over the next year. In summary, Plasty is a great technique for scars in the malar area as it prevents a cicatricial ectropion of the lower eyelid and leads to great cosmesis. Carbon dioxide laser resurfacing is an excellent tool to help scars remodel. The belief for many years has been that carbon dioxide laser resurfacing is unsafe in pigmented skin. Nothing can be further from the truth. It just needs to be used in different fluences and powers as compared to the white population. And finally, as we become more and more super specialized and use newer and newer techniques and gain experience in them, patient care benefits.